My name is Dr. Imad Alsakaf. I am a psychiatrist. Since I studied behavioral sciences in my early school of medicine, I chose psychiatry right away. I was fascinated by the field of behavioral sciences and psychiatry. The subjects of emotions, thoughts, behaviors fascinate me, and I feel intrigued by them. Also, I feel the field of psychiatry is distinguished compared to the other fields of medicine in that there is a huge art to it besides the scientific aspect. Of course, we study human behaviors, human emotions, human thoughts. We have research studies that dictate our approaches in terms of medications and other forms of treatment. But that's not enough. We have the art part of psychiatry where you have to know the individual patient in depth, to know their values, their goals, their experiences, their emotions, their sufferings. You have to understand that every individual is so different than any other individual. And you have to basically connect the two aspects together, the scientific aspect and this individual aspect in a way that has a lot of art to it. I feel the relationship between a psychiatrist and a patient is more in-depth and more intimate than the relationship that a patient would have with any other medical specialist. That's why I love the field of psychiatry. I like to work here because I have all of the services that I need to take excellent care of my patients available for me, starting from all kinds of imaging studies, lab studies, all kinds of inpatient and outpatient facilities and programs. I have the ability to provide pharmacological treatment or treatment with medications, psychotherapy, electroconvulsive therapy or ECT, which is such a great treatment for some patients who have some conditions that treatment is not available in a lot of facilities. I also feel supported by administration. No one interferes in between me and my patients. I do what I think and what they think is best for them. These are the reasons why I love being here and working here. When you visit with me, you would expect not only a non-judgmental attitude, but also a loving and respectful attitude. I know it is much harder to ask for help when you have a heart attack or cancer than it is to ask for help when you have disturbed emotions and behaviors or thoughts. I have deep respect to people who struggle with mental health illnesses. It is very difficult to have to deal with these problems, and it is even more difficult to have to ask for help for it. Not only I respect my patients, but I have a deep love for them, and I have a lot of respect for them. So you would expect to be respected, you would expect to be listened to. I know it's very hard to talk about sensitive private experiences, and it makes it harder if you get interrupted. I avoid interrupting my patients to the best of my ability. I want to listen to you because I know your problem is different than the problem that I have read in textbooks. I want to understand to the best of my ability your values, your goals, what makes sense to you. And then you would expect an up-to-date fund of knowledge where I try my best to share with you my professional knowledge and experience. And you would also expect not to be intimidated into accepting my recommendations. I make recommendations to the best of my ability, but I know that it is your life, it is your body, it is your decision. And you will feel at ease sharing with me what you prefer and what you don't prefer. Are you serious? I have no free time, but I still manage to steal some free time, and I like to spend my time with my daughter and with my wife, my other family members. I have a large family here in town, luckily. I also enjoy reading all kinds of subjects. I like history and literature. I also like some physical activity. I love tennis. I love swimming. I do all of that, at least to some extent. And I love studying languages. Currently, I'm studying Spanish. So with the limited free time I have, I try my best to really enjoy it and have quality life.